Hi, this is Dr. Roy Hall, and I want to welcome you to our Autoimmune Issues webinar. I think it's going to have some really exciting information for you, and I want to just begin with a short video here.
And I sleep through the night.
And you're losing weight?
And I'm losing weight, yes.
Hot damn.
Hot
Okay.
damn.
Okay. Thank you.
My name is Brenda Birch, and we've started this program, end of May, 1st of June, and I've lost 26 pounds. My joints don't hurt. I haven't had the heartburn. I sleep really, really well. Just lots of little changes. I have better energy. I don't nap in the afternoon. I just have that afternoon energy that I didn't have before. And just coming off the detox, so I'm excited to get going on more.
Okay, so people ask me, what do we do in our clinic? And I respond, you know that fella that has that extra giddy up in his go, who's happy off all medications? That's what we're helping to create with our folks. And in fact, we call them clients or members. We really don't call people patients in our program. And other thing I tell people is, all those drugs I put you on the last 4 years in a standard medical clinic, I'm now going to take you off those medications. And my story goes back to functional medicine, really going back to the 1990s. I'm going to go over that in just a few minutes with you. And well, here it is right here. I was a medical oncologist for roughly 32 years and got a little burned out of that. I did my training at MD Anderson Hospital, was on staff there for a year, went into private practice, and then later went back to a university setting at Texas Tech University School of Medicine to teach oncology to the medical students and residents, and then again went back into private medicine because I missed the interaction I had with the people. But I became disillusioned with traditional medicine, and you'll hear about that why also as we go through this process here. But I now have a functional medicine clinic in Billings. This opened in March 2016, and we're having a great time working with people like you, helping people like you get well, get off their medications. And I've seen in my practice, basically people have three things they come to us for. Number one, they want to be able to sleep at night, have a good sleep, or they want to have enough energy during the day to work and play, or they just want to feel well and be well. And I ask my folks, do you think we're put on this earth for a purpose? Do we have some type of purpose to fulfill in our life? And I'd say 95% of people say yes. And then my next question is, you think you can fulfill that purpose if you're not feeling well or if you're sick? Or can you help your spouse fulfill their purpose if you're not feeling well or being sick? And everybody answers no. So health is very important. It's important for us to do things we want to do, but it's also very important to have to fulfill our destiny of why we're put on this earth. And I do think that we're put on this earth to reach out to other people. We're all part of a collective bigness. And it's our role really to be well, get well, teach other wellness, and to help each other do things they're supposed to be doing on this planet. So what I'm going to show you through this webinar here, one, why you may be having trouble getting well, what's not working in our medical system. Then we're going to discuss what autoimmune disorders are, and then hopefully put it all together in a package that's kind of new to you in thought process, but a package where you can say, that looks doable. I think I could do that. And that's what I hope to have happen here. So, functional medicine, this is not a new concept. It was first coined probably back in the 1990s. I started doing this back in Chicago in the 90s with my oncology patients. And we have one saying that the genes are the gun, the environment is the trigger. And what this means is if you're born with a certain set of genes, those genes do not have to be expressed. They can be suppressed, and we can stimulate those good genes to help protect us. And so an example is Angelina Jolie with her double mastectomy because she carried the BRCA gene for breast cancer. Functional medicine, we say, really that's probably not necessary. And history also promotes that in the last 3 years, the number of prophylactic double mastectomies has tripled in this country. And the change in breast cancer incidence has not changed a bit with that mutilating procedure. We tend to treat the root of the illness as opposed to the symptoms, which are treated by traditional medicine. An example that works very well is, say, somebody with diabetes. The fellow with diabetes goes to his primary care doctor, his internist, or his endocrinologist, and the doctor says, here, take this metformin or this glipizide pill for your diabetes, or take this insulin. We got to get your sugars down. We know in functional medicine, most people who have diabetes have it because of an insulin resistance. And we know in functional medicine that there are things we can do to lower that insulin resistance. We can do that through diet and lifestyle changes, through supplementation, and through getting your hormones balanced. So when we do that, we can take somebody coming in our door on 2 or 3 diabetes medicines, doing the changes we do with them, in 2 to 3 months, they're off their diabetes medication. And it's a common thought process in this country that once you have diabetes, you have it for life. And folks, that just ain't so. You can get rid of the diabetes. Now, are you cured of diabetes? That's a tricky thing. Cure implies that it will never come back. If you change your lifestyle back to what you had before you had the diabetes, yes, it can come back. But if you make these lifestyle changes and get your hormones in balance, the diabetes goes away and stays away, and the sequelae of the diabetes, such as blindness, neuropathy, heart disease, also improves. So our feeling in functional medicine is it's better to treat something early, and it's so much better to treat the root cause of the issue rather than treating the end symptoms. So I asked my folks, are any of you taking medications? 95% of them raised their hands. And then I asked, do you think those medications are making you well or getting you well? Or is it just treating the symptoms? And I'd say majority of the people realize that the medications don't get them well, they just make the symptoms better. And then I asked, do you think we're in a healthcare crisis in this country? And almost everybody raises their hands, and for all kinds of different reasons. Some of them being, well, we don't eat right, too many donuts, too many sodas, we don't exercise right, we watch too much TV. I want to throw out 3 other major reasons that we in functional medicine say we are in a major healthcare crisis. And unless someone gets out of the box and does something different, they're going to stay in that crisis. It's not going to go away, folks. It's simply going to get worse. And the first big entity that's causing our crises are the pharmaceutical companies. Now, we have some fantastic medications at this time. We have pills that lower your blood pressure much better than they did 10, 20 years ago. We have medications that lower your blood sugar much better than we did 10, 20 years ago. But we have more people with diabetes, we have more people with hypertension, we have more people with cancer. We're not getting people well with these medications. And you got to realize that the person in the United States, we consume 50% of all prescribed medications in the world, but we only have 5% of the population. And these pharmaceuticals companies are making a lot of money off of us, and they like that. And when I was an oncologist, people would say or ask me, why don't you ever celebrate Breast Cancer Awareness Month? And I would reply, do you know where that concept comes from? And most people don't. Well, back in the 1990s, AstraZeneca had a drug called tamoxifen, and tamoxifen is still being used for breast cancer now. It's a great drug. It's an anti-hormone pill. And they were trying to enroll young women who had high risk for breast cancer onto this medication study to see if they could prevent breast cancer in these women with high risk. And initially, the women were not buying it. They did not want to take part in it. So they came up with this idea, let's have this Breast Cancer Awareness Month will paint everything pink. We'll go to football teams, basketball teams, corporations, and say, if you'll put this pink ribbon on your logo or on your jersey, we can work together. And sure enough, that started spreading across the country, and the women started enrolling on the drug studies. And you know, we got some really fantastic information out of that. And people say, well, what's wrong with that, Roy? And I say, well, nothing's wrong with that. That's just simply good marketing. What I object to is in the 1990s, during this time, AstraZeneca was number 3 in the world for putting carcinogens into the environment. So here was this company putting carcinogens into the environment to cause cancer, and then turning around and selling a drug to treat cancer. And to me, there's something not ethical about that. The other problem or issue in our healthcare crises that's not going away is health insurance. And this is an election year, and there's all kinds of discussion about Obamacare. Is it going to be repealed, or is it going to be strengthened? Is this our answer? And I say, you know, that's really not the big issue right now. What health insurance has done is taken away our accountability to ourselves. People think, well, if I have health insurance, I can do whatever I want to, and if I get sick, my health insurance will take care of me. My friends, it will not take care of you. From a financial standpoint, it does not work. Last year in this country, the most common cause of bankruptcy was due to medical reasons. 75% of those people who filed bankruptcy for medical reasons last year in this country had health insurance. It's not going to take care of you health-wise either. It doesn't pay for you to have things done to you that change your lifestyle and get you well. What it does pay for is to keep you on the circuit, on that hamster wheel, running in place where you never get off of that hamster wheel. The other thing insurance has done through Medicare is they've reduced the fees that the doctors get paid per patient. So what ends up happening when the doctor gets paid less for seeing his patients? Well, he starts seeing more patients in a day. So now in our community, a standard office visit is around 20 minutes. Now think about what that 20-minute visit is. When I was working in the clinic, it would take me about 2 minutes to review your records to see if you've been to another doctor or been to the emergency room or had laboratory studies done or x-ray studies. And then at the end of the visit, it'd take me about 5 minutes to discuss with my nurse what we needed done in terms of lab work or prescriptions, and to document my notes in the computer. So that leaves me and you about 13 minutes to talk and to visit and to have an examination. Out of that 13 minutes, I'm supposed to ask you, well, how was your weekend? What are you doing this winter? How's your spouse doing? And then we finally get to the issue. And say you come in with insomnia, you can't sleep. About the only time we have left at this point, and insomnia has causes that if they're explored, we can get rid of the insomnia without medication. But when you only have that 13-minute window to discuss all of this stuff, you don't have time to find the root cause of that insomnia. So what ends up happening in the traditional clinic, the doctor says, here, take this Ambien, and I tell you what, come back in 2 months and tell me how it's working. Now I know when you come back in 2 months, I'm not going to have any more time then than I do today. So the questions are going to be very similar. And the questions will be, how is that Ambien working? If you say, great, I'm going to say, here's another prescription, come back in 6 months. If you say it's not working, I'm going to say, shoot, here's another sleeping pill, get this one filled, come back in 2 months and we'll talk about it again. So we keep going on this vicious cycle of never getting the root cause addressed, but treating symptoms with pills. The third problem in our healthcare situation are our hospitals. They have come to realize that these clinics are cash cows, that traditional medicine keeps these people coming back every few months back into the system. They're not really getting well. They're having the symptoms treated, but they're not getting well, and this goes on forever. So they're buying up all these clinics and making a ton of money. Now, think about this. In our community here in Billings, we have several grocery store chains, Albertsons is probably the more dominant one. What's in every grocery store, Albertsons in Billings, Montana? People say, well, a pharmacy. And I say, well, what else? And they think about it and say, oh, a clinic. And yes, there's a clinic in every one of our Albertsons here in Billings. Now think about this, folks. Just think how wrong this is. You have diarrhea. You've been sitting on the toilet 2 or 3 or 4 times a day, and you decide to go in and see that doctor. Or you have this head cold that you're blowing your nose into your Kleenex or handkerchief, or wiping your nose on your hands, and you go see the doctor at the clinic, at the grocery store. That doctor says, you need a prescription, so you need to go back out into the grocery store. So you go back to the pharmacy, or he says, just over-the-counter remedy. So you go back out in the grocery and you get your medication, and you think, holy moly, I just don't feel good. I think, I need to do some grocery shopping, and so let's get it done today so we don't have to come back tomorrow. So you go from that clinic with your diarrhea, with your runny nose, and you go get you a buggy and you start pushing it through the produce, and you start looking at the lettuce, the tomatoes, the apples, and you start doing your shopping. Now think about this. From a public health standpoint, there's probably nothing worse you could do than put a clinic inside of a grocery store. From a marketing standpoint, there's probably nothing better you could do than put a clinic in a grocery store. And to me, it's very similar to that drug company. On one side, they're putting carcinogens into the environment to cause cancer. On the other side, they're selling a drug to treat that cancer. So we're in this big healthcare crisis for 3 big things, and unless people get out of the standard box, start doing something different, things are not going to get any better in their health. And so we have this crisis. A lot of it's from wrong information, but it all ties back to financial incentives. My friends, we are in a 21st century epidemic, and it's from medications. Do you know the number 3 cause for death in this country last year, right behind heart disease, right behind cancer, was medications in hospitals? If you look at that bottom line, 450,000 preventable medication-related adverse events in the United States every year. Here in Montana, one of our major cities is Bozeman. If you get on Google and Google the population of Bozeman in 2015, they're going to tell you it's 32,500. If you divide 450,000 by 12, that comes out at 37,500. So just imagine people here in Montana, every month throughout the year, every person in Bozeman has an adverse medication reaction, a serious one, and that's 12 months a year. That's a lot of people. That middle one, drugs kill more than MVA, that's motor vehicle accidents. We live in probably the greatest country on the earth, but when you look at our health care compared to other industrialized countries, we're 47 out of 197. We are in the bottom 25% in terms of health care, yet we spend more money per person than any other country in the world. We have more doctors than any other country in the world, and we have more hospitals than any other country in the world. Second, at the bottom line, the BMJ, that's the British Medical Journal, says 85% of medical procedures are unnecessary. And what they mean by this is if you have chest pain, you go to the emergency department, you see the cardiologist, and he puts a stent in you. He will get paid around $1,500 for that stent. The problem with that procedure is that it does not cure the heart disease. It alleviates the chest pain, but does not treat the heart disease. You still have heart disease. If you go to a primary care physician and he spends an hour with you teaching you how to change your lifestyle, your diet, activity levels, and this will reverse the heart disease, this will cure the heart disease, he'll get paid about $45. So you tell me, which doctor is more likely to treat you, the one who gets $1,500 for the procedure, the one who's going to get $45? Now, I've been bashing our healthcare system, and the bottom line, 90% of all diseases are not treatable with orthodox medical procedures according to the World Health Organization. Just a second for a sip of water. What this means is 90% of what our healthcare in this country is treated inappropriately. The 10% that's treated excellently, and when I say excellently, it's in the top of the world, and that's our emergency care services and our surgical procedures. If you fall and break a hip and need that repaired, or if you do need that stent put in your heart, you will get the best surgical care in the world. You'll have the best hospital equipment in the world. But it's that other 90% of healthcare that we're doing so poorly with. And this is our chronic illnesses, things as diabetes, hypertension, autoimmune disorders. We're not very good at that, folks. And to get good care, you got to jump out of that box and do something different. So what you got to do to get healthy, you got to be proactive. You got to take charge of your health care. Stop being dependent upon others. I ask a lot of our folks, do you exercise? And they all say yes. And I say, well, what do you do? They say, well, I walk my dog. And if you live in Billings, Montana, you see this every day as we drive along the interstate by the old power plant. People walking their dog. This is not exercise. I mean, getting good exercise, being really proactive, taking charge of your health care. That's going to get you healthy, not going back to the clinic and asking for another medication. Now, let's change the music and start looking at some of the autoimmune issues and what autoimmune definitions are. And these are just a few of the autoimmune conditions that are very favorably treated with functional medicine. And these include fibromyalgia, irritable bowel disease, Crohn's, multiple sclerosis, psoriatic arthritis, gout, rheumatoid arthritis, systemic lupus, scleroderma, pernicious anemia, Hashimoto's, Graves' disease. And this is just a partial listing. So if you have any one of these, run to a functional medicine practitioner. So what happens in autoimmune disorders? Well, we have a lot of inflammation, and this is a central aspect of these conditions, whether it's obesity, diabetes, atherosclerosis, Alzheimer's, Parkinson's, depression, or autism. And a little bit of history. In the 1990s, we had the Human Genome Project, and what they did with this was to map out all the genes that humans have. And at the end of the study or the project, the scientists were a little bit upset because they only found like less than 25,000 genes in people. They thought we're a lot more complex than that. But what this thing allowed them to do is really get good at mapping out the genetic structure of DNA, RNA. And out of this project came the Human Microbiome Project in 2007, which was completed in 2011. And what these scientists did was look at the bacteria and their genetic information in different parts of the human body and trying to evaluate the role in health and disease, what these bacteria were doing to our lives. And they looked at such areas as nasal passages, the oral cavities, our skin, our GI tract, our urogenital tract, which is the kidneys, bladder. And what they found was something very amazing. They found that we have over 1 million different bacterial genes in our bodies as people, and an untold number of viral genes and fungal genes that they have not counted. And the other amazing thing is 75% of these bacteria that they identified out of this study had never been seen before, and because they'd never been grown, they could not grow on the agar or the culture media that we have in our microbiology laboratories at the universities or hospitals. So these were brand new bacteria we didn't know anything about. And it just kind of floored everybody. You know, we have more bacteria and their genetic material than we have cells in the human body. That's amazing. And what they're finding, an association, is many of our chronic illnesses look to be linked to infectious causes. And what's happening is these infections and these autoimmune disorders all have the shared symptoms such as fever, fatigue, weight loss, joint inflammation, neurologic disorders, skin lesions. Some of the autoimmune things being systemic lupus, as stated above, rheumatoid arthritis, vasculitis, some of the infections, tuberculosis, syphilis, Lyme disease, and all the symptoms relating to these infections and autoimmune disorders are due to liberation of pro-inflammatory cytokines, tumor necrosis factor, and things such as interleukin-1 and interleukin-6, meaning that the autoimmune system has been turned on and is overacting. And when we think about our immune system, basically it's designed to kill things. And in a very simple explanation, we have an acute phase and we have a delayed phase. The acute phase is Th1 or T cell helper 1. And I tell people, think of this like the Marines. They land on shore, they have their artillery, machine guns, and their job is to kill as much of the enemy as they can. Now, when they don't get this done within a day, then the delayed action takes over. And think of this as perhaps being somebody like the CIA or FBI. They're not out to round up large numbers and eliminate these numbers, but they're out there marking these people so that they can call the Marines back in to come back and shoot and to kill. Now, with a lot of autoimmune issues, when you go to the doctor and you say, well, why do I have this? Why do I have systemic lupus? Or why do I have rheumatoid arthritis? The standard answer, well, it's an idiopathic disease, which means we don't know. Well, what we are learning is there's biotoxins that cause the autoimmune system to start playing out. And these can be living organisms such as infectious agents, bacteria, viruses, or non-living agents such as chemicals or heavy metals. And when you only have a 13-minute office visit, it's much easier to say it's idiopathic and sound good than start trying to explore what these causes are these various biotoxins. And what ends up happening, you get these biotoxins within our system, and us being the host, the biotoxin being the pathogen. And so what ends up happening, that pathogen can do direct damage to the host, or the host can initiate the autoimmune process trying to inactivate that pathogen. And what ends up happening is that autoimmune process turns back on the host and causing damage. And well, here's just a few of the bacteria and biotoxins and how they relate back to infectious diseases such as Lyme disease or group A beta hemolytic strep and rheumatic fever. So in our healthcare system, when you have an autoimmune process or you have any process and you walk into that doctor's office, there's two main thought processes that occur. The first process or first thought is, what medical condition do they have? The second thought is, what drugs do they need? And what's happening with our Western medicine is we have a very linear thought saying we have an event, that event causes a symptom, and because of that symptom, there's one magic bullet to fix that symptom. And what really happens is there's all different avenues to these different symptoms. One person from the same event may have some heart issues, another person may develop cancer, another person may develop rheumatoid arthritis, and we got to go back and find really what's causing the problems rather than what condition do you have and give a bullet for that symptom. And what's happening, the pharmaceuticals are making a lot of money off this project or this way of thinking. In fact, it's interesting, last year the pharmaceuticals spent more money on marketing than they did on research and development. So these things at the bottom, the thyroid, the diabetes, hormone imbalance, current system with a linear thought, once you have the issue, you're going to be taking medications for life. Truth is, we can reverse many of these problems, but we have to investigate why they're going on, and then we have to make some changes in our lifestyle and what we eat and nutrition and exercise, and doing that we can reverse the problem and the problem goes away. Now, several symptoms here that can be autoimmune. You feel tired, you get sluggish, you go to the doctor, he orders blood tests, they all come back, he says everything is normal, and his response then is, Maybe you need more sleep, maybe you need more exercise, you do all of that, you don't get better. Then he says, well, maybe you're just getting old. Or he says, that's just part of having rheumatoid arthritis. People are tired. Or that's part of fibromyalgia. You just don't have energy. Or you're depressed, and so he puts you on an SSRI, Zoloft or Paxil or Cymbalta or any of the other antidepressants. And this is a real bugaboo of mine, depression. Functional medicine people say depression is not an illness, it's a symptom. There's something going on wrong in the body. Let's figure out what that is, and let's treat that, and the depression goes away. We are made to believe in this country that all people with depression have low serotonin levels. My friends, do you know there's not been one study in the world done that shows newly diagnosed people with depression have low serotonin levels? That just is simply not true. And I have been on antidepressants, 2 of them. My doctor put me on these. And coming off the antidepressants is harder than coming off alcohol, narcotics, or heroin. It's hell. It can be done. You get your hormones in balance, do some lifestyle changes. Europe does not use the SSRIs. They use diet and lifestyle, and they have better results in getting people undepressed than we do in this country. People have mood swings, so the doctor says, well, it's probably hormonal, or, this is just part of being sick. Get used to that. No, there's mood swings, and there's causes for that, and we need to find out what the causes are. Now, there's several issues when you go in the doc and your lab tests are all abnormal. Are normal. And there's reasons they can be normal and you still don't feel good. Some of it is that the lab ranges are inaccurate. Some of it is because bell curves are used that don't always identify the ill person or the well person. And a good example here is thyroid. In our community, the normal value is really between about 0.4 and 4.5. A lot of places it goes from 0.3 to 5.7. Functional medicine says that's way too broad. We need to narrow it down. And our range is from 0.4 to 2. So if you're outside this range, above 2 or below 0.4, you're abnormal, and we need to address that. But traditional medicine gives you this wide latitude that we're missing a lot of people who are hypothyroid that should be treated and treated correctly and have things such as T3 looked at. Another funny lab test is testosterone. Most labs, it varies between 200, 800, or 200, 900. Most men in their 50s and 60s, 70s are probably in the 250 to 350 range. They'd all like to be up to 650 range, and the problem when we go to replace hormones using the synthetic hormones that we have from our drug companies in this country is with the creams, we only get about a 50, 60 point rise. So if you're down in that 250 to 300 range, we're not going to get you very high with those creams. We can go to the testosterone injections, which are synthetic in this country, that will get you a good rise up to 800, 900. Problem with that is that blood level only stays high for like a day, so you need to repeat that shot at least twice a week. So now we have guys going up to 900 one day, down to 200-300 the next day, then back up to 900 with the next shot. And so they're on a real roller coaster ride with their hormones. And this causes a lot of trouble in terms of mood and disposition. Another lab that's often misused misused in this country. You're tired, you finally get your doctor to check your cortisol level, with the idea being it may be low and you have no energy, and he gets a blood test, a one-time test, and it comes back okay. The problem with cortisol is it goes up and down throughout the day. Typically it's high in the morning, lower in the afternoon. What you need to do is check this thing throughout the daytime. You need to check it before lunch, before dinner, and at bedtime. This is not done in the doctor's office. You know why? Finances. Insurance will only pay for one blood test. We can do a simple saliva study for about $100 and get this done at home and know what's really going on and give you a better answer. So if you have any of these problems here, diabetes, autoimmune issues, hypothyroidism, you got to have the correct test done and they have to be interpreted correctly. Look at this. 90% of all thyroid symptoms among U.S. women are due to autoimmune disorders, and it's Hashimoto's and Graves' disease. Traditional docs will not check for Hashimoto's, and the reason being is they do not have a medication to treat that, so they don't want to know what's going on. Functional medicine, we do check it because we know we can treat it effectively, very effectively, and reduce the Hashimoto's. And it's done simply by giving T3 and T4 hormone replacement and lifestyle changes, decreasing the immune response. Other organs that are affected by autoimmune issues are right here. So it's not just having joint pain, but it can be Alzheimer's, multiple sclerosis, endometriosis, even osteoporosis. You don't have to have that Fosamax that can cause bad arthritis in your jawbone. We can treat osteoporosis with hormone manipulation and diet and lifestyle. So the traditional thought process with autoimmune disorders is, as I mentioned a while ago, it's a very linear process, thinking that a magic bullet can solve the problem. And this is where we get our subspecialty medicine, like cardiology, oncology, nephrology, is they divide us all up into these various organs because according to this thought, there's only one problem with each illness. And if you address that, or if you treat that illness symptoms, you're going to get better. In metaphoric terms, traditional medicine says inflammatory diseases are to be viewed as a kind of war that needs to be fought with the most powerful weapons available. The desired outcome is to win that war by shutting off the inflammatory process as quickly as possible. The end justifies the means, and one should accept that certain degree of collateral damage. One friend of ours, autoimmune problem, she went to her doctor, he suggested these medications, and she said, "Hey, you have children, don't you?" "Yeah." "And you're telling me I need to be on this medicine for life, right?" He said, "Right." He said, "Well, would you put your children on this medication for life?" His response is no. And she says, "You're asking me to take it for life. You're not willing to give your own children this medicine. I don't think I'm going to do this." These medications have big cost to them. Things such as methotrexate or flutamide being used often in early rheumatoid arthritis now. Rheumatologists saying we're trying to protect your joints down the road, but these immunosuppressants carry risk of causing cancers, lymphomas, leukemias down the road. Some great monoclonal antibodies that treat symptoms of autoimmune disorders, but they have the possibilities of tuberculosis and serious pneumonias and death from sepsis. These are big-time medications, folks. So the functional medicine approach is not to treat with big-time medications, not to wage war on the immune system, but to help our clients make dietary and lifestyle changes that will reduce exposure to harmful inflammatory triggers. And we want to employ a rational mix of antioxidants, biologic response modifiers, and/or other therapeutic nutrients and supplements to assist the person's immune system in moving back towards balance, not shutting it down, but moving it back into balance. So, change directions again. How can you get help? First off, let's get out of the box. Any of you ever have a mentor or a coach, a piano teacher, dance teacher, football coach? The question is, why did you have this coach? And people say, so I could learn this task better and faster. Well, here was my first coach, the guy on the right in the foreground. That was my father, Jack. He taught me a lot. He showed me how to study to get into medical school. He taught me to work hard and to play hard. Trouble is, Jack didn't have a good health mentor. Jack died at the age of 50 plus 1 week from a heart attack. And people say, Roy, that's just life. And initially I thought, yeah, that's life. But the more I thought about it, the more frustrated I got. Because if Jack would have had a good health coach, somebody who would have shown him how to live and be healthy, he might still be around. And the advantages of that would be my wife would have gotten to meet him and know him. And most importantly, my 2 children would have known their granddad, and he would have known his grandkids. So not having a mentor for health reasons is, in my book, just kind of a selfish thing to do. We have too many people counting on us, and as I said earlier, we're all put here for a purpose in life, and to fulfill that purpose, we need to be healthy. So we need that mentor to help get us healthy. That's what we do in functional medicine. We really don't write prescriptions. We can write them, but we help people get healthy. We become their mentor. Here's my mentor that helped me get off my 2 antidepressants, Dr. Charlie Webb, half my age, twice as smart as me. And then I tell people, if you're going to get well, it's a daily choice, because either you're going down the wellness path or you're going down the illness path. And it's a choice that you make every day. And to make that wellness choice, sometimes it's hard to do. It's easier to eat donuts and drink sodas than to get out and exercise or to eat good food. 2 of my reasons are right here. My son Isaac, my daughter Rachel. My biggest reason why is my wife Sharon here. This is a fishing trip a couple of years ago off the coast of Washington State. Last winter we took a wine trip down to Chile and Argentina. I want more trips like this. And the big reason I'm doing all of this for me is Sharon, I want to be able to take care of her when she needs me. I want to be the last one standing. I do not want her to take care of me when I'm sick and to be left alone after I pass away. I want to be the last one. I'm very selfish about that. And so I ask you, do you have a reason why you want to get well? And if you don't, you better find one if you want to get well. So again, 90% of all diseases are not treated by orthodox medical procedures. What this means is you got to get out of that box, get out of that standard clinic box, do something different. Can you predict the future of your health? And the answer is certainly, but you got to order the right test. We got to look at the underlying causes of what's going on in your life. We need to treat the cause, not the symptoms, correct the dysfunction, not alter the labs with drugs. Address the body as a whole, have a systemic approach, all through mentoring. Now, we address 5 different areas in health of our clients in functional medicine. The first one being detox. And I don't mean a Betty Ford type of detox in the hospital, but we got to give that liver and that colon a chance to recuperate from the years of medications, the years of physical stress, emotional stress, the tolls that have gone on in the body, because we need that liver and we need that colon to function properly. Next, we need to learn how to eat right. Functional medicine, we really don't count calories, and I tell people you could have 2 identical twin sisters. One you send to Weight Watchers and she gets a 1,200 calorie diet a day. The other learns how to eat healthy fats, healthy proteins, and eats 2,000 calories a day. Which one do you think is going to be more fit, more shapely, and more healthy at the end of the year? Yes, it's that gal who's eating the 2,000 calories of good fats, good proteins. So it's learning how to eat right and eat smart, and it's not hard to do. It's not hard to go out to restaurants and eat this food. It just takes a little bit of training. Not difficult. Next thing we do is work on fitness. We got to find fitness program that you like, that you will do, because exercise is important for health. And again, part of this is just learning how to do it smartly. People don't know how. They buy these gym memberships and go work out, 5 days a week for an hour a day. We tell people 30 minutes, 3 days a week. We can get you shape, we can get you fit, we can get you weight loss. It just learning how to do it. Next, we start dealing with the nervous system in functional medicine, and this is twofold. One, it's learning how to deal with stress. There's measures we can teach you that are very effective in just a few weeks of changing how you respond to stressful situations. The other thing we're learning is that the gut and the brain are closely associated with each other. As I mentioned earlier, Europe treats depression with diet and lifestyle. They know what you put in the gut, what you feed the body, can affect the mood. And so we work on that. And fifthly, hormones. We got to get the hormones in balance. And we got to look at all different hormones together. You can't just look at one, but you got to look at the sex hormones, the testosterone, the estrogen, progesterone. And when we optimize these, we use bioidentical hormones, which have been used in Europe since the 1930s. And what this shows, their studies show, is you have less heart disease, you have less cancer, you have less Alzheimer's, you have less blood clots, and healthier bones when you're using bioidentical hormones versus the synthetics that we have in this country. And the reason the bioidentical are really not used a lot in this country, it goes back to finances. You can't patent something that's normal or natural. You can't patent water, you can't patent dirt, you can't patent testosterone. So our drug companies say if you're going to use a hormone in this country and you can't patent it, then they're going to come up with a synthetic hormone that looks sort of like it, patent it, and use it. And that's where people are getting in trouble with more blood clots, more heart disease, more strokes, and more cancer. We've got to look at the thyroid and look at things such as T3 and T4, the ratio, not just look at TSH. And we check things out like cortisol levels with people, DHEA levels. And we got to have a system of looking at this with everybody. Just like me going to med school, we had curriculum. Well, we have in functional medicine a curriculum that we run people through, and we address all these issues. And we're coming down to the last 2 slides, or last 3 slides maybe. 3 questions here. How would your life be if you were able to resolve these health issues? If you did not have these autoimmune issues, what would be different? How has your life been affected in the past? How have your relationships with your loved ones been? Your ability to work, to enjoy a life? And lastly, I'm asking you, oh, that went too quick, I'm sorry, but it's asking, what is your motivation for change? And on a scale of 1 to 10, I tell my folks, if you're not an 8, 9, or 10, then probably we are not going to work together. With functional medicine, you don't go to the clinic, write a check, and get a prescription. With functional medicine, you work with your mentor, with your coach, and you go through some lifestyle changes. And if you're not motivated, it is not going to work. I can promise you that if you are motivated, and if you do the work, you're going to get some good benefits. So, what's next? Pretty self-explanatory here, I think. Just simply stop procrastinating. I told you in the beginning, I hope to present some new ideas to you, or ideas in a new way that made sense, that you could say to yourself, you know, this makes sense. I understand now why I'm having trouble. I understand now that I need to get out of that box and do something different. And I think I can do it. So if you can do that, stop procrastinating and take action. So if you want to be able to sleep better at night, to have more energy during the day to work and play, to feel well, be well, and to make a difference in your life and others, then let's get together, okay? You need a curriculum just like I had in med school. You need a coach. You need a mentor. That's us at our clinic. And you need to commit to getting well. And I promise you, if you do those 3 things, you will get well. And so 3 questions. Can we help anyone or everyone? And the answer is simply no. And it goes back to that motivation. If you're not motivated, this thing will not work. If you are motivated and if you put the work in, I can promise you that you will get benefit, you will get better. Do we take insurance? And the answer is, unfortunately, no. At this time, insurance does not pay for what we do to get you well. Insurance will pay for me to give you Remicade or Rituxan or methotrexate, but it will not pay for us to sit down and help you change your lifestyle. And then lastly, how much is it? And I have to tell you, I don't know, because I don't know what you have at this point. I don't know what you want. I don't know what you need. I will tell you that our programs are affordable. We have single parents doing it. We have retirees doing it. We have people on fixed incomes doing it. So next steps, if you're ready to make a change, if this made sense to you, simply call the office for an appointment and bring in your spouse. And I have 3 rules really. Number 1, bring that spouse. I want that person there not so much to twist their arm in doing the program, but I want to know from them how motivated you are. I want to know from them that they're going to support you through this process. And then, only reason not to bring this spouse or favorite person is you're about to kick them out of the house. In that case, just leave them at home. But honest to God, people, we're talking about making some big changes in your life. I want to know from that spouse, are you ready to do it? And is that spouse ready to do it? Then I ask that you bring the paperwork that we get to you. That's very important. If we don't have the paperwork, we can't start. And then I ask that you show up on time. Now, what we'll do on that first visit, have a consultation, a wellness evaluation, come up with a plan of action. In billings proper, standard office visit is around $250 for a 20-minute visit. What I end up doing, people who have watched this webinar, I'm going to charge you $87 for it. And the reason I charge that is in my old clinic at the hospital, I can see 25 people in a day. And if one didn't show, that was okay. Our new clinic, we only see 6 or 7 people a day max. And if one doesn't show, that's a significant hole in our schedule, but more importantly, that's cut out another person that could show up when there's only a handful that we can see in a day. So I ask that you pay this up front, and I'll tell you, if your spouse wants to do the program, I'll charge that spouse $47. If that spouse who comes with you does not want to do the program, I'm not going to twist his arm and make him do the program, but again, I want him there. So I want to thank you for your time. I thank you for your curiosity. I can promise you we can help you, and we would love to help you. So simply call the office, and that number is 406-969-6310. Ask for an appointment, and let's get together. So thank you. Have a good day.